All right. So, here we go with labor and delivery. You should have done childbirth terms. So, next part is labor and delivery. So, an obstetrician, if you've ever heard of an obstetrician is a doctor that's trained to deliver the baby. Sometimes you'll hear these doctors called OBs, because it starts with OB. Okay, they're a doctor. You also have a midwife. A midwife is a trained professional that can deliver low risk babies and pregnancies. So, lots of people who give birth at home have a midwife there to help them. Most people who give birth in the hospital have an obstetrician to help them. Most midwives are not in the hospitals, but every once in a while, somebody has a midwife and a doctor there. It's usually whatever the parents want. Okay, so just keep that in mind. All right, so this is a birthing room. This is where labor, delivery, and recovery all occur in the same room. So that's called a birthing room. This is a delivery room. A delivery room is used for a cesarean section or other complications. So basically, this is kind of more of a surgery, like an operating room. Um, you can see that they look very different, right? Like they're still in the hospitals, but they look very different. All right, so some anesthesia stuff. So, an epidural is used to give relief of pain and discomfort. It's the most common form of anesthetic used in the Intermountain West. It's given in a small space in the patient's back. It does not get to the baby, so it has no effect on the baby at all. It's purely for mom's comfort. Some disadvantages are that the woman's blood pressure could drop and she could develop a headache. Okay. Doesn't happen to everybody, but it does happen to some people. It could happen. Okay. So, I'm going to show you some pictures. Epidural is given in the low back. It's given in between two vertebrae. Sometimes they'll give an anesthetic shot to numb it first. Sometimes they don't. It depends on the anesthesiologist. So, what happens is it goes in between the two vertebrae into the spinal column. It does not go into the spinal cord or else you get paralyzed. But it goes into the spinal column. Okay. And then, so it goes in the space right there. And then the needle is removed, and there's a long tube called a catheter that stays in place that administers the medicine. So, this is why it doesn't get to the baby, because it's going into mom's spinal column, not into her bloodstream. So, baby doesn't share mom's spinal column, but baby shares mom's bloodstream. So it goes into the spinal column, and basically it makes mom numb from the waist down. Now, I kind of equate it to if you've ever gone to the dentist or like to the orthodontist and they like numb your mouth, right? They're filling cavities or doing work in your mouth, and you can feel it, the pressure, and you can still feel things that are happening, but it doesn't hurt. It's kind of like that for mom with an epidural. It doesn't necessarily hurt, but she can still feel the contractions. Okay? So, if you've ever heard of somebody having what they call a natural birth, that means that they had childbirth without medication. They chose not to have an epidural. Lots of times, people who choose to do natural births use breathing techniques to work through the pain. So if you've ever seen a TV show or a movie when they talk about going to birthing classes or things like that, and they do like weird types of breathing, like stuff like that, that's breathing techniques to work through the pain. So since this is purely mom's choice, right? It has no effect on the baby. Some moms choose to have all natural births. Some moms choose to have some natural births, some not, some epidurals. It's completely up to mom. Okay. All right. So, some types of delivery. We're going to go over this. Actually, I'm going to pause here in this video and then I'll pick it back up once we get here. Okay?